Hi, I'm Kirsten Eagles. My student number is T00698082. Today I'm going to be going through the vet facility that I work at. So this is Southpaw Animal Hospital, so we'll head on inside. So this is the lobby. So this is where we get all of our patients checked in, get them weighed. We have 3 exam rooms as well as 1 quiet room. That's where we do most of our euthanasias as well as consults with the doctor. So we'll head on over and we're going to get a file started. Okay, so we're going to start by creating a medical file. So what we do first is we get all of the owner's information. So we'll start a file here. We've got, we'll say, Joe. We would get an address, 123. We'll say Fredericton, New Brunswick, get their phone number, and then email if they want, as well as any alternative contacts that they want on there that they want to have permission on the file. So we would say okay to that, and then we're going to start a medical record or medical file for one of the patients. So we'll start with the pet's name, so we'll say Fluffy. We would get the species of the pet, so we'll say canine. The breed, we'll say poodle. And we'll go with white. And then we would get the date of birth, the estimated date of birth. So we'll say he's a couple years old. And then we would get their gender as well as if they're neutered or if they're spayed. We'll say a female spayed, and then any other information that we get. So say they're coming from a previous clinic, we would get the records from their previous clinic and have those entered into their actual medical records right in here. This is as well where we would put any sort of client communications that we have. If they give us a phone call, then we would put anything that was talked about in there. And this is as well where the doctor would put all of their notes. Okay, so now I'm going to show booking an appointment. So basically we would get to a day where we have some open slots, so we have all of our open appointments here. So we would first ask if they have any preference for doctor, and then try to find a time that best suits them for that. And then we would insert a new, we would make sure we have the correct patient selected. We would put in the reason, say vaccines. And as well, we have our appointments color coded. So if they're coming in for an exam, vaccine, surgery, something like that. So say they're coming in for vaccines, we always initial to see who booked the appointment as well. And then we hit OK, and the appointment is booked. All right, so next we're going to head out back and we're going to get a prescription ready. More back this way. So this is our out back area. So here we have our lab as well as our prescription area. So all of the cupboards are labeled for the types of drugs that we keep in there. So we have cardiac, stimulants, anti-anxiety, steroids, antibiotics, and then anti-inflammatory, ear and eye meds. So we have a prescription here. You can see that. So this is for a coworker. So we're going to be getting some Galliprant ready for her. So on the labels, we always have the name of our hospital as well as our address. We have the prescription number, the doctor who prescribed the medication, the date, and then we have the patient name, the owner name, the species of the animal, and then the directions for the medication, the type of medication as well as the dosage, the quantity as well as the manufacturer, and any refills that are had on the medication. And then always for veterinary use only and to keep at a children's reach. Grab our prescription bottle. Attach the label. And then we always put our signature. And then at our clinic as well, we always have one other staff member check the medication and put their signature as well, just to avoid any sort of mistakes. Okay, so next we're going to move into our treatment area. So this is where we do most of our treatments. It's where we prep for surgery, do nail trims, all of that good stuff. So over here we have all of the books that any of us would need. So we have our protocols book as well as our controlled drug log. So our protocols is where we keep all of our standard operating procedures. So this shows how to turn on blood machines, how to clean those, as well as, cleaning the centrifuge, cleaning surgery instruments, prepping for surgery, anything that a new tech might need to know. All right, so next we have our controlled drug log. So this is where we list all of the controlled drugs that we have. Anytime any of them are used, they're always written right down in here. So I've made up a sheet here. So this one is for buprenorphine. So what we would do, we would write the date that it's dispensed. We'll say March 9th. The owner's name, I'll just use my own. The pet's name, we'll say my cat Floki. The amount that's being dispensed, so we'll say 5 mils. And then the amount that's left over. So this is always counted, usually daily or weekly. And then you would put, we'll say 145. And then we always initial who has taken that medication out. All right, so next I'm going to show where we keep records of lab results. So we have a couple places. So the first one is if we have any labs that are going outside of the clinic, so if they're going to Provincial Vet Lab or if they're going to IDEX, we would write them all in here, owner, patient name, the sample, the lab it's going to, what test is being run. That way we have an idea of what's being sent out. And then as far as like blood work or anything that's done within the clinic, everything is kept within the medical record. So if you go into the medical record, so I'm using the medical record of my coworker's dog. She gave me permission to do that. So all up here we have the laboratory results. So here shows any labs that have been run, shows the date that they were run, all of the values. So you can see these were done on the 20th. You can go through back and see May. Again, everything's all right there. And then as well the doctor's notes on those labs. All right, so this is our x-ray room. So this is where we do all of the x-rays. And all of our x-rays are stored right on the computer. So I'll show you here. So this is just x-rays of my cat, Mason. So you can see all of the dates when an x-ray was done. You can see those. They're all kept right on there. As well on the home screen, it'll show you any x-rays that were done that day. You can search any patient that's had x-rays done, and everything would be right there for you.